Welcome to the chapter on the appendicular skeleton of the skeletal system, and we will cover this content in one lesson. The primary function of the appendicular skeleton is to participate in movement and manipulation. By manipulation, we mean the ability to physically move things or objects, to grip, to grasp, to move around, to arrange. So that is the action of the distal parts of the skeleton, specifically the hands and the phalanges, as well as the phalanges of the pedal region. The appendicular skeleton includes the bones of the upper and lower limbs. So we're talking about the bones that make up the brachial and antebrachial region, as well as the manual areas, as well as the bones of the femoral region, the crural region, and the pedal region. Also part of the appendicular skeleton are the bones of the girdles, and the girdles attach the limbs to the axial skeleton. We will look at the pectoral girdle that attaches the upper limbs, and the pelvic girdle, which attaches the lower limbs to the axial skeleton. Each upper limb has 32 bones, and it sounds like a lot, but again, we're talking about multiple numbers of phalanges, carpals, metacarpals, etc. So it's not really a lot of bones to name. First, we have the pectoral girdle, or the shoulder girdle, which is made up of a clavicle and a scapula on either side. The upper limb itself, or the free parts, include the humerus in the brachial region, the radius and ulna in the antebrachial region, the carpals that make up the wrist, the metacarpals that make up the palm of the hand, and the phalanges in the fingers and the pollex, or the thumb. Here we have a diagram of the thoracic region depicting the bones of the pectoral girdle, the clavicle and scapula, as well as the proximal upper limb, specifically the humerus bone, just to show you significant regions on these bones and how they articulate with each other, allowing the upper limb to attach to the axial skeleton via the pectoral girdle. So on the left, we have an anterior view. You can see that the clavicle forms a joint medially with the manubrium of the sternum, and laterally with the acromial process of the scapula. Anterior and inferior to the acromion is the coracoid process of the scapula, and these two processes form attachment points for ligaments and muscles through tendons at the shoulder joint. Laterally, on the side of the scapula, we have a depression called the glenoid cavity, and this is the area that articulates with the humerus to form the glenohumeral joint, or the shoulder joint. On the diagram to the right, we have a posterior view, and this shows us some of the anatomical features of the scapula. So you can see that the scapula is a triangular shaped bone. It's a flat bone. It has a prominent horizontal ridge called the spine. You can actually palpate that with your hand. You run your hand along your shoulder blade, and the spine continues laterally to become the acromion, which is that process that projects over the humerus. You can barely see the clavicle in this view, as well as a bit of the coracoid process. Okay, but this is just to give you an idea of how the humerus articulates with the scapula to form the shoulder joint, or properly the glenohumeral joint, as well as how the bones of the girdle form and articulate with each other. So the clavicle is an S-shaped bone. As we saw, the medial end articulates with the manubrium. That joint is called the sternoclavicular joint. That was easy. And laterally, the clavicle articulates with the acromion of the scapula. So that joint is called the acromioclavicular joint. The scapula is the second bone of the pectoral girdle. It is also called the shoulder blade. It is triangular in shape and is another example of a flat bone. The most notable features include the ridge that lies posteriorly called the spine. and it extends laterally into the acromion. The acromion is the flattened lateral process of the spine that projects over the humerus and articulates with the clavicle. Anterior to it and slightly inferior is another process off the lateral aspect of the scapula called the coracoid process. So this is a protruding projection on the anterior surface, just inferior to the lateral aspect of the clavicle. Finally, very important, is the glenoid cavity. This is a shallow lateral depression or concavity that receives or articulates with the head of the humerus. So when we mentioned that the humerus forms a joint with the scapula to form the shoulder joint, that joint is properly called the glenohumeral joint, and it is where the humerus, the head of the humerus, articulates with this glenoid cavity of the scapula. In this diagram, we have an anterior view of the scapula. This would be the right scapula from our skeleton. Anteriorly, you can see the more inferior and anterior coracoid process. Posterior to it, we have the larger, more superior acromion, and not labeled, but you can see that little blue region. That's the facet that receives the lateral aspect of the clavicle at the acromioclavicular joint. Laterally, we have the facet that makes up the glenoid cavity. So this is where the humerus would articulate with the scapula to form the glenohumeral joint or the shoulder joint. All right, and then we have the lateral border, inferior angle, medial border of the scapula. The single bone of the brachial region is called the humerus. Now, the name may suggest that this is your funny bone, but it's not. Your funny bone is actually the olecranon process of the ulna that forms a joint distally with the humerus. However, here we are so named. This is the longest and largest bone of the upper limb. The proximal end is ball-shaped and articulates with the glenoid cavity of the scapula at the shoulder joint. The distal end, as we mentioned, articulates at the elbow with the radius and fits into a groove in the ulna. So we looked at the structures of the shoulder joint, also shown here, where the head of the humerus articulates with the glenoid cavity of the scapula. There are several prominent features on the humerus, especially at the distal end where it forms the elbow joint with the radius and the ulna. Please note the trochlea, which is a depression in the medial aspect of the distal humerus. This fits into the trochlear notch created by the ulna. So that is those are the main surfaces responsible for the hinge joint at the elbow. On the right of the page, we have a posterior view that shows you the olecranon process of the ulna that extends into the humerus and forms the tip of the elbow. And this is where the ulnar nerve runs. And that's the nerve that when it is hit, creates that tingling sensation. Some describe it as painful. And they say you've hit your funny bone. But again, it's not the humerus that got hit. It was a nerve running over the surface of the ulna. Within the forearm or the antebrachial region, we have two long bones. The ulna is the longer of the two, and it is located medial to the radius. Important features of the ulna include the olecranon, which is a large, prominent proximal end, and the tip of the elbow. So that's actually your ulna that forms the tip of the elbow, not the humerus. The coronoid process is the anterior lip of the proximal ulna that also fits into depressions within the humerus. The trochlear notch, as we mentioned, is a deep fossa that receives the trochlea of the humerus, particularly when the elbow is flexed or when your elbow is bent. And the styloid process is the thin cylindrical projection on the posterior side of the ulna's head, and these processes act as attachment points for ligaments and tendons. The radius is the more lateral of the two forearm bones, and again, this is referring to anatomical position, because you'll note that when the hands are pronated, the ulna actually rotates around the radius so that the radius becomes medial and the ulna is lateral. But we are describing the normal anatomical position where the radius is lateral and the ulna is medial. The head and the neck of the radius are at the proximal end close to the humerus, and the radius articulates with the humerus and the ulna at the elbow joint. The radial tuberosity is medial and inferior to the neck and is attachment site for the biceps brachii muscles that are responsible for flexing the elbow. The shaft or the diaphysis of the radius and ulna are connected by bands of connective tissue, fibrous connective tissue that make up the interosseous membrane. And that again allows these two bones to move against each other, and they also form the proximal and distal radio-ulnar joints. Here we have a diagram of the right ulna and radius in relation to the humerus and the carpals. We've already described how these bones articulate proximally with the humerus at the elbow joint, so let's move distally to the wrist joint. You will notice that the wrist joint proper is formed by the radius and three of the carpal bones, specifically the scaphoid, the lunate, and the triquetrum carpal bones articulate with the radius to form the wrist joint. Now, when an individual trips and falls, they often extend their hands out to kind of catch themselves and break the fall. That leads to fractures of these bones. A common fracture in those over the age of 50s is a Colles or Colles fracture, which is a fracture at the distal end of the radius. Others often will fracture that scaphoid bone in the proximal row of the carpals. As we mentioned previously, the bones of the carpal region are arranged in two rows. The proximal row contains the three bones that articulate with the radius to make up the wrist joint, specifically the scaphoid, the lunate, and the triquetrum. The proximal row also contains the pisiform carpal bone. The distal row contains the trapezium, trapezoid, capitate, and hamate bones. Please just focus on the three that we specified, the scaphoid, lunate, and triquetrum, and specifically the scaphoid, as that one is commonly fractured with a broken wrist. You may have heard of carpal tunnel syndrome. Now, the carpal tunnel is a space that runs between the carpal bones and a thick band of connective tissue called the transverse carpal ligament or the flexor retinaculum. Got it. Now, this is a passageway for the median nerve that extends into the hand, as well as several flexor tendons. When this passageway becomes narrowed due to inflammation or injury, it gives rise to a condition called carpal tunnel syndrome, characterized by pain in the hand, numbness, and sometimes loss of function. So the carpus or the wrist consists of those 8 small bones that we identified previously, again arranged in 2 rows. Again, the scaphoid is the one most commonly fractured when one extends their hands to break their fall. Distal to the carpal bones are the bones of the palm, which are the metacarpals, and these are numbered 1 through 5, lateral to medial. Now, while the carpal bones are short bones in that they're cube-shaped, the metacarpals and the phalanges are all long bones. They are small long bones, but anatomically each bone has a diaphysis and two epiphyses. Beyond the metacarpals, we have the phalanges, or the phalangeal bones. There are 2 in each thumb or pollex and 3 in each of the other fingers for a total of 14 phalanges per manual or per hand. Together, these bones form a few joints. Between the carpals, we have the intercarpal joints. We also have the carpo-metacarpal joint, which is just beyond the wrist joint. Then we have the metacarpal phalangeal joints, which make up the knuckles, very prominent when the fist is clenched. And finally, we have the joints between the phalangeal bones, or the interphalangeal joints. These allow one to bend the fingers. And here is a diagram of the wrist and the hand bones in relation to the ulna and radius. So the 8 carpal bones are identified, as well as the metacarpals. Here you can clearly see that they are long bones, as well as the phalanges within the digits. At the bottom is a mnemonic to help you remember the name of the carpal bones in order, but again, do not dwell too long on this. We are going to finish the skeleton by considering the bones of the lower limb. Technically, the lower limb consists of 2 separate regions. There is the single pelvic girdle, which is made up of the 2 coxal or hip bones, in addition to the 30 bones that make up the free part of each lower limb. Please note that the lower limb bones are larger and stronger than the upper limb bones due to the fact that the lower limb bones support the weight of the body, and the joints between them are considered weight-bearing joints. Here's a description of the pelvic or hip girdle. So each coxa, or each coxal bone, hip bone, is actually formed by the fusion of 3 individual bones: the ilium, the pubis, and the ischium. The ilium is the more superior of the 3, the pubis is the most anterior of the 3, and the ischium is the most inferior posterior. Please note that ilium here is spelled with an ILI, as in the I in hip, as opposed to the ilium, which is a region of the small intestine. That is spelled ILE. Think E for eat for the ilium of the small intestine. Think I for hip for the ilium of the pelvic girdle. Now the 2 coxal bones are joined anteriorly at the pubis region by a joint called the pubic symphysis, which is a fibrocartilaginous joint. This joint relaxes and allows for easier passage of the fetus during delivery. Posteriorly, each coxal bone articulates with the sacrum to form the sacroiliac joint. So here we have a beautiful picture of the bony pelvis. You can see the 2 lateral coxal or hip bones. Superiorly, we have the ilium, and inferiorly, we have the ischium, and anteriorly, we have the pubis bones. And you can see the broad band of connective tissue between the 2 pubis regions that form the pubic symphysis. You can also see the sacroiliac joint posteriorly, where the 2 hip bones meet the sacrum of the vertebral column. On the next few slides, we'll give descriptions of each part of the coxal bone. The ilium is the largest of the 3 bones that fuse together to make up the hip bones. The ilium is a superior part and also forms a socket called the acetabulum that receives the head of the femur at the hip joint. The superior border of the ilium is called the iliac crest, and this is the part of your hip that you rest your hand on when you're being impatient or when you want to give somebody attitude. That's the iliac crest. The ilium contains the greater sciatic notch, which allows for passage of the large sciatic nerve that runs posteriorly down the femoral region towards the leg. The ischium is the inferior and posterior part of the hip. The most prominent feature is the ischial tuberosity, and this is the part of your hip bone that sits on the chair. So you're probably using that right now. And finally, we have the pubis, which is the more inferior and anterior part of the hip. The two pubis regions meet anteriorly at the pubic symphysis joint. On this diagram, we have each part of the coxal bone highlighted. So you can see that the ilium is the largest and most superior bone. And on the diagram to the right, you can see the iliac crest. Note that the three bones meet laterally to form the acetabulum. Let's say that together. Acetabulum. And the acetabulum is a deep depression that acts as a socket for the head of the femur, forming the hip joint. The acetabulum is comparable to the glenoid cavity of the scapula that receives the head of the humerus at the shoulder joint. But note that this socket is much deeper, so the hip joint, while very flexible, is not as flexible as your shoulder joint, where the glenoid cavity is a more shallow and less stable depression. Also note the ischial tuberosity that form the seat of the hip bone, and those are the major anatomical features that you need to focus on here. The pelvis is divided into a superior and an inferior portion by an imaginary line called the pelvic brim. The pelvic brim is an oblique and angled border that is outlined on the right of the hip in this diagram. It defines the more superior region, which is called the false or greater pelvis, which is bordered by the lumbar vertebrae posteriorly and the upper portions of the hip bones laterally and the abdominal wall anteriorly. So technically, the space enclosed by the false pelvis is part of the lower abdomen, and it houses the intestines, the lower intestines in both the male and the female, and the uterus, ovaries, and uterine tubes in the female. So these reproductive organs are actually located in the lower abdomen. Inferior to the pelvic brim is a region called the true or lesser pelvis, which is quite small compared to the abdominal region. It has an inlet, an outlet, and a cavity, and this is the area that defines the pelvic region of the abdominal pelvic cavity. The true pelvis contains the rectum and the urinary bladder, as well as the vagina and cervix of the uterus in females and the prostate gland in males. If you compare the pelvis of a male to that of a female, you will see several differences. For one, the bones of the male pelvis are usually larger and heavier, and the main differences in the female pelvis are related to the requirements for pregnancy and childbirth. For example, the female pelvis is wider and shallower than that of the male. The pubic arch between the two pubis bones is also wider, and the pelvic brim or inlet is wider and more oval in the female, as well as the pelvic outlet, which is also wider. So these modifications are accommodations for pregnancy and particularly childbirth. So here you can see some comparisons between the false pelvis, shown in pink, which forms the lower abdominal cavity, and the true pelvis, shown in blue, which defines the pelvic cavity. And here we have a table comparing the female and male pelvises. Please just focus on the ones I mentioned a couple slides ago. For the comparison of the pelvises between the male and the female, showing again the wider pelvic outlet in the female. Also note that the coccyx is more flexible and curves more anteriorly in the female. Finally, we've reached the free bones of the lower limb or the lower extremity. In the thigh region, we have the femur or the thigh bone, which is the longest, heaviest, and strongest bone in the body. The proximal end or the head of the femur is very prominent and inserts into the acetabulum to form the hip joint. The distal end of the femur articulates with the tibia, known as the shin bone, and the patella to form the knee joint. The patella is a sesamoid bone that reduces friction at the knee joint. The patella is also called the kneecap. All right, so here we have the bones of the right lower limb, including the pelvic bone. And you can see the prominent head of the femur fitting into the acetabulum of the hip. Distally, the femur articulates with the tibia and the patella at the knee joint. And in the leg region or the crural region, we have the shin bone, which is the tibia. Again, that is the more anterior and medial of the two leg bones. And laterally, slightly posteriorly, we have the fibula. And then the bones of the pedal include the tarsal bones, the metatarsals, and the phalanges. The longest, heaviest, and strongest bone of the body is again the femur. It's hard to miss. It has a very prominent head as well as processes. The head of the femur articulates at the hip joint in the acetabulum, and the neck, which connects the head to the diaphysis, is a common site for fractures. So when an individual breaks their hip, it's actually the neck of the femur that is most often fractured, not the coxal bone. Distally, the medial and lateral condyles of the femur articulate with the condyles of the tibia, forming the knee joint, which is properly called the tibiofemoral joint. Also note that the patella articulates with the femur, contributing to the knee joint. In this diagram, we can see how the bones of the knee joint come together. So it's interesting to note that here the femur articulates with the tibia and the patellar bone anteriorly, but not the fibula. So the fibula is not part of the knee joint at all. We mentioned that the condyles of the femur articulate with the condyles of the tibia, and the patella, being a sesamoid bone, helps to reduce friction in this, the most complex joint in your body, the knee joint. Let's move on to discuss the bones of the crural region. The tibia is one of two bones within the leg or the crural region. The tibia is the larger, more medial and weight-bearing bone of the two. Its lateral and medial condyles at the proximal end again articulate with the femur at the knee joint. And distally, the tibia articulates with the talus of the tarsal bones at the ankle as well as the fibula to form the ankle joint. Like the radius, the tibia articulates with the fibula at both the proximal and distal ends. There are tibial tuberosities that again act as attachment sites for the ligaments of the knee joint, particularly the large patellar ligament. The fibula is a smaller and more lateral of the two leg bones. It is non-weight bearing. It does form both a proximal and distal tibiofibular joint. And as we mentioned before, at the distal end, it articulates with both the tibia and the talus to form the ankle joint. The fibula and tibia are connected by interosseous membrane, similar to the radius and the ulna, that allow for slight movement between these bones. In this diagram, we can see the superior talus bone, which is the major tarsal bone that forms the ankle joint. In the posterior view to the right, we can see another major tarsal bone, the calcaneus, which makes up the heel. Finally, we're at the foot. We're really getting towards the end here. In the foot region, we have the tarsals, the metatarsals, and the phalanges. There are 7 tarsal bones in each limb. Again, the talus articulates with the tibia and fibula at the ankle joint. And then we have the long, strong, weight-bearing calcaneus. In the arch of the foot, we have 5 metatarsals. Again, those are long bones. And similar to the hand, there are 14 phalanges in the foot. So the big toe is a hallux. It has 2 bones, believe it or not. And each toe, including that short, stubby pinky toe, contains 3 phalanges. So here are the bones of the tarsal region, the 5 metatarsals, and the 14 phalanges. The only tarsals for which you are responsible are the talus, which is the large superior tarsal bone on which the tibia and fibula sit to form the ankle joint, as well as the large calcaneus bone. The bones of the foot are arranged in 2 continuous arches that support the weight of the body and distribute the weight to maximize support, as well as maintaining posture, and provide the ideal distribution of the body weight over the soft and hard tissues of the foot. The arches also provide leverage to the foot when walking, and these arches are held in position by ligaments and tendons. There are 2 abnormalities to the arches. You may have heard of flat foot. This is when the arches decrease or fall. When this happens, the individual does not have the proper distribution of weight in their feet, and this can lead to inflammation as well as tendinitis and shin splints, fractures, bunions, and calluses in the feet. The opposite abnormality is called clawfoot, and this is when there's too much of an arch due to different pathologies, including diabetes, where nerve damage leads to atrophy of the muscles of the foot. Here we conclude with a diagram of the arches of the foot. We have the transverse arch across the foot, lateral to medial, as well as the longitudinal arch. So there is the medial part and then the lateral part of the longitudinal arch. And again, these arches enable the foot to support the weight of the body and provide ideal distribution of the body weight, while also providing leverage while walking. And these arches allow for flexibility and spring back during walking and weight bearing. So that's the end of our skeletal system. We will now move on to put these bones together in joints or articulations, many of which you've already met in this unit. So the chapter on articulations should not be too much of a surprise for you. See you then.